In this video, I'm going to tell you all about turf toe. So first off, what is turf toe? It is a sprain of the first metatarsophalangeal joint. So I know it's a mouthful. When we talk about metatarsals, those are the long bones in the foot right here. And then the phalanges are the little bones that make up your toes. And also it's the same name as the bones that make up your fingers. So metatarsophalangeal joints are the joints where your metatarsals connect to your first phalange of each toe. So a sprain of the first metatarsophalangeal joint means it's the metatarsophalangeal joint of your first toe, which is the big toe. So it's injury to the soft tissue structure in the plantar complex. So all the structures that make up sort of the bottom part of that joint. And that includes the plantar plate or the collateral ligament. There's also a sesamoid bone there, so a little floating bone and a tendon that could be injured. There's all sorts of structures that are located right in that area. And so turf toe is when we have an injury that looks like this in this picture that sort of overstretches. It could tear things, it could break bones, it can injure that whole sort of plantar surface of that joint. And that's what turf toe is. So signs and symptoms. So pain, especially with activity. In more severe cases, there'll be swelling and bruising, and I'll talk about severity in a couple slides. It'll also hurt if you touch it. There'll be limited range of motion, partly due to the swelling and partly limited by pain. And it will also feel better if you wear hard-soled shoes. So with hard-soled shoes, you have less mobility of these joints. There really isn't any need for those joints to move if the sole of the shoe is very stiff. So it will feel relieved when you wear a shoe like that. So the injury mechanism, how does this happen? It happens when the foot is planted and the ankle dorsiflexes. So dorsiflexion is like the opposite of planting your foot. So plantar flexion is when you like push on the gas pedal. Dorsiflexion is when you bring your toes back up towards you. So if you're standing on the ground and you dorsiflex, like your body leans forward and the ball of your foot is firmly planted on the ground, and now this angle of your ankle joint becomes smaller. So like your shin is moving towards the top of your foot. That's dorsiflexion. And so when we do that and the toe plants on the ground like that and the foot keeps moving forward, then we're going to damage all these structures on the plantar side of the joint. So on the bottom part of the joint. And that's where turf toe comes in. So it's the first metatarsophalangeal joint is forced into hyperextension by a combination of friction between the shoe and playing surface, body weight, and forward momentum. So it happens when your shoe has too much traction on the surface that you're on, and then your body weight and forward momentum carries your body forward. And so then you sort of plant the ball of your foot and your momentum brings your body on over your foot, and then it will injure the bottom part of that joint. It's called turf toe because it happens more commonly on artificial turf, but it really could happen on any surface. It's the same injury mechanism can take place anywhere, but it often comes down to what type of shoe are you wearing. So the more stiff soled it is, the less likely this is to happen because you won't get as much range of motion in that joint. And the more flexible the sole of your shoe is, the more possible this becomes. And then when you have a lot of friction between your shoe and whatever the floor type is or whatever the surface is, that's going to make this more likely to occur. So severity, we grade it 1 through 3, with grade 1 being the least severe and grade 3 being the most severe. So grade 1 means that you kind of stretched out the joint capsule, the ligaments, the tendons. And so there is a kind of slight sprain there. It'll hurt if you press in certain places where it was injured. There might be a little bit of swelling, but this is the least severe case. Then as we get to grade 2, now we have some partial tearing. And it's going to hurt in more area. So it's more widespread tenderness, the swelling will be worse, and there will probably also be bruising. And then movement of the toe will be limited and painful. So in grade 1, there's not too much limit in range of motion. But in grade 2, there will be more limitation, partly because of the swelling and partly because of the pain. Grade 3 is the worst. It's the most severe. That's where we have a complete tear of the plantar complex. So the tear is much more severe. It'll cause much more pain, tenderness, swelling, bruising, much more difficulty with movement. Grade 3 can also include more severe injuries like fracture of sesamoid bone that's right in that area, and other structures. So there's other structures that can be involved here, and that ultimately might require surgical repair depending on what is damaged. So treatment and healing. Again, grade 1 is the lightest, easiest version of this injury. So first, rest, ice, compression, elevation. So normal first aid treatment of this type of injury. You might take anti-inflammatory medications like ibuprofen, that sort of thing, to help reduce the inflammation. You might take pain relievers like Tylenol. And then you might stabilize with tape, or a stiff-soled shoe might help, because with that stabilization, it will allow it to heal. And so depending on how the person's feeling and what sport it is that we're referring to here, they might be able to continue play if they have proper stabilization. So it might be kind of not severe enough that they need to be out of play, but if it's properly wrapped or they wear a stiffer soled shoe, it might protect it enough so that it can still heal and not interfere with play. Grade 2 means that they might need a walking boot maybe for a week or so to give it more stabilization, and they certainly can't return to play during that phase. They would follow the same protocol as for grade 1, so all the same rest, ice, compression, the medications, those sorts of things. But the difference here is that it will require more stabilization, like with a walking boot, and they would need more rest before return to play. That could be up to 2 weeks generally. Grade 3 is the most severe. They would likely need a walking boot or a cast that they might need for several weeks before returning to play. As it heals and it progresses, it would then be kind of downgraded and treated as a grade 2, and then eventually as a grade 1 as they get ready to return to play. We probably also with a grade 3 would need physical therapy and exercise program that will help strengthen muscles and ligaments and prevent stiffness, because stiffness is your big enemy here. Is that you need to work on mobility pretty early in the healing process on this one. Otherwise, you might end up with a lot of stiffness in that joint, which would reduce range of motion, would reduce power in your push off and that sort of thing. So physical therapy early on is going to be important here. So it's really important that you get this diagnosed if it is pretty severe. If it's more than just a grade 1, like if you base it on your signs and symptoms I discussed previously, if you think it's a grade 1, it'll heal on its own. You don't have to worry about it too much. If it's worse than that and it might be a grade 2 or a grade 3, then absolutely you need to go in and get this checked out so that they can give you a walking boot, that they can prescribe you physical therapy as needed. Because if you try to just muscle through this and don't get proper treatment, then you're not going to be able to work on that stiffness. That stiffness is what the stiffness and then ultimately pain can be lingering for a long time without proper treatment and a proper healing process after this type of injury. And then also grade 3, as I mentioned, can be severe enough that it does require surgical repair. And so, of course, you need doctor help for this one. So make sure that you're getting that checked out. All right. Thank you so much for watching this video, and I hope that you have a great day.